Medicare terms. Understanding key Medicare insurance terms can help you navigate Medicare policies and make better informed decisions. Here are some important terms. Beneficiary, an individual who receives Medicare benefits. Original Medicare, Part A and B are referred to as Original Medicare because they date back to Medicare's creation in 1966. PDP, a Medicare prescription plan provided by an insurance carrier also known as a carrier, commonly known as Part D Medicare Advantage, also known as Part C. They are Medicare plans provided by a private insurance company, carriers, and require that benefits are equal to Original Medicare, but frequently have additional benefits such as dental, vision, and hearing aids. These plans incorporate Parts A and B and frequently Part D as well. Medicare Supplement, also known as Medigap plans, are supplemental plans that cover all or part of the deductibles and coinsurances of Original Medicare. They are provided by private insurance companies. Premium, the amount of money you will pay to Medicare for your Part B, Part C Medicare Advantage plan, and/or your Part D prescription plan. Part B is either deducted from your Social Security or Railroad Retirement Board benefit check, or directly to Medicare if you are not on Social Security or Railroad Retirement yet. Deductible, the amount you must pay out of pocket for covered expenses before your Medicare, Medicare Advantage, or prescription plan carrier starts to pay for your benefits. Copayment or copay, a fixed amount you pay for covered services, such as doctor visits or prescription medications, at the time of service. Coinsurance, the percentage of costs for covered services that you pay after you've met your deductible. For example, if your coinsurance is 20%, you would pay 20% of the covered costs, and Medicare or your insurance carrier would pay the remaining 80%. Out-of-pocket maximum, or limit, the most you have to pay for covered services in a plan year. Once you reach this limit, the insurance carrier typically pays 100% of covered services for the rest of the year. This only applies to Medicare Advantage and prescription plans. Prior to 2024, prescription plans had no maximum. Original Medicare has no maximum out-of-pocket. Network, the facilities, providers, and suppliers your health insurer has contracted with to provide healthcare services. Medicare has the broadest network of any insurance. Medicare Advantage and prescription plans have narrower networks. Always check to make sure your doctors, facilities, and pharmacies are networked before starting a plan. Prior authorization, approval from Medicare, Medicare Advantage, or a prescription plan before you receive certain services, medications, or treatments. In-network, healthcare providers or facilities that have contracted with Medicare, your Medicare Advantage, or your prescription plan to provide services or prescriptions at pre-negotiated rates. It is critical to determine if a doctor or facility is in network to avoid the full or additional cost of services. Out-of-network, healthcare providers or facilities that do not have a contract with Medicare or your plan. Services received from out-of-network providers typically cost more to you and may require the provider accept the responsibility to bill the plan and accept the payment terms. Otherwise, you may pay the full retail amount for the services rendered. Exclusion, specific conditions, treatments, or services that are not covered by Medicare. Benefit, the healthcare services or items covered by Medicare and your plan. Grace period, the period after the due date of a premium payment during which the policy remains in force without penalty. Formulary, a list of drugs covered by your plan. Over-the-counter, medications that are for sale without a doctor's prescription. Preventative care, a set of services, medications, supplies, and vaccinations that are covered by Medicare and your plan. Diagnostic test, a test ordered by your doctor to diagnose a condition. Medicare differentiates between preventive and diagnostic tests. Renewal, the process of continuing on your policy for another year. These are just some of the many terms you may encounter when dealing with Medicare. Understanding them can help you choose the right policy for your needs and navigate your Medicare more effectively.